There are several new drugs that are in development, advanced phase, that are promising. I'll focus on the most, obviously advanced. So there is a drug called APR-246, and that's a p53 modulator, particularly developed for patients with p53 mutation, which is around like 20% or so of the higher risk MDS. Historically have very poor outcome with a median survival of 4 to 6 months. And that compound is given in combination with azacitidine, and it had gone through phase 1 and 2 phase 2 studies and just finished accrual on the phase 3 trial. In the phase 1, phase 2, complete responses are above 50%, so it looks very promising. So we'll touch base on that. Then the other compound is Magrolimab. This is a drug that targets a receptor called CD47 that usually is expressed on the MDS or leukemia cells, preventing the macrophages from engulfing the leukemia cells or attacking them. So they call it the don't eat me signal. And the drug blocks that. And again, it's been tested in MDS AML in phase 1, phase 2 studies, and had shown again, above 50% response rates, 1/3 of the patients achieving minimal residual disease, and it's going into a phase 3. The third drug is Pervindostat. This is an deletion inhibitor that actually had finished a phase 2 randomized study showing a leukemia-free survival or progression-free survival, particularly in the higher risk, and it's going in a phase 3 in that setting. So now we have 3 drugs kind of advanced, clinical studies as a combination with hypomethylating agents in hope of either to improve the response rate or the durability of those responses. And those obviously will allow us as a better bridge to transplant because we'll have higher rates, or even for patients that are not going to transplant, more durable responses and more patients responding. We'll touch base a little bit on Venetoclax. That's a very important drug added to our armamentarium in myeloid diseases. It's approved by the FDA for leukemia. We'll discuss a little bit its role in MDS. And then obviously there is a niche for some of the targeted therapies like the IDH1, IDH2 inhibitors in MDS as well. So a lot of the combinations, and maybe just put the word there that down the road, maybe it will be the triplet even treatment. Then a little bit discussing about what to do after HMA failure, because that remains an area of unmet need. When patients don't respond to the upfront therapy or they responded for a while and lost the response, just discuss few of the options, what's going on with research, maybe talk a little bit about the Venetoclax role in that setting. And if I had more time, I may talk about when it goes to AML. But basically, it's really providing overview of how to identify patients with higher risk, the role of transplant, and then basically how to hopefully soon be moving beyond the hypomethylating agents.